This year, a tool to fight the opioid epidemic became more widely available, and new screening guidelines hope to prevent lung and breast cancers. Michael George looks back at the year's top health stories.
Drugs used for weight loss like Ozempic and Wegovy soared in popularity in 2023.
They stimulate the pancreas to make more insulin. They make you feel fuller faster. They reduce your appetite.
A study from Novo Nordisk, the drug maker behind Wegovy, found it can also reduce the risk of heart attack, stroke, or heart-related death by 20%. Two new therapies to treat patients with sickle cell disease are now available. One uses a gene editing therapy known as CRISPR.
You're changing somebody's DNA, so obviously you want to make sure that the corrections you're making are the ones you want.
In July, the FDA approved the first over-the-counter birth control pill, called Opill. 2 months later, the agency approved Narcan as the first over-the-counter medicine that can reverse opioid overdoses.
If it's in the store, in the aisle, right next to ibuprofen, it really also helps to reduce stigma.
CVS pulled phenylephrine from shelves after an FDA advisory panel decided the popular decongestant likely provides no more relief than a placebo.
Talk to your local pharmacist, local provider, about what the alternatives are.
The fight against Alzheimer's disease received a boost when the drug Leqembi received regulatory approval. Trials show it slows early progression by about 27%. Updated COVID-19 vaccines that target recent variants became available in September, though just a small fraction of Americans have gotten the shot.
I know folks want to leave COVID in the rearview mirror, but unfortunately it is still here.
Protection became available against RSV for the first time. Pregnant women and older adults can receive a vaccine, while the antibody shot Beyfortus helps prevent the virus in babies.
As you know,
the near death of Buffalo Bills player Damar Hamlin during a football game in January spurred a national movement to teach more people CPR. Screening guidelines for breast and lung cancer were updated in hopes of saving more lives. The American Cancer Society lowered the age for a yearly low-dose CT scan to 50 for people who smoke or formerly smoked a pack a day for 20 years, or 2 packs a day for 10 years. And the U.S. Preventive Services Task Force now says women should begin regular mammograms at the age of 40 rather than 50. Michael George, CBS News, New York.